Hello everyone and welcome back to Banana Life. Today, we're diving into an important and sometimes under-discussed topic, men's health issues. Specifically, we'll be talking about prostate cancer, testosterone, and a range of other health concerns that men face. Understanding these topics can help men take better care of their health and well-being. Let's get started. First, let's talk about prostate cancer. Prostate cancer is one of the most common cancers in men. The prostate is a small gland located just below the bladder and in front of the rectum. It produces fluid that makes up part of the semen. Prostate cancer occurs when cells in the prostate gland grow uncontrollably. While it's a serious condition, many men diagnosed with prostate cancer do not die from it, especially if it's detected early and treated properly. The risk factors for prostate cancer include age, family history, race, and lifestyle factors. The risk increases as men get older, with most cases occurring in men over the age of 65. Having a father or brother with prostate cancer also increases the risk. African American men are more likely to develop prostate cancer and are also more likely to develop it at a younger age and have more aggressive forms of the disease. Lifestyle factors, such as a diet high in red meat and high-fat dairy products and low in fruits and vegetables, may also increase the risk. Early-stage prostate cancer often has no symptoms, which is why regular screening is important. When symptoms do occur, they can include difficulty urinating, a weak or interrupted urine flow, frequent urination, especially at night, pain or burning during urination, blood in the urine or semen, and pain in the back, hips, or pelvis that doesn't go away. If you experience any of these symptoms, it's important to see a healthcare provider. Screening for prostate cancer typically involves a prostate-specific antigen, PSA blood test, and a digital rectal exam, DRE. The PSA test measures the level of PSA in the blood, which can be elevated in men with prostate cancer. However, elevated PSA levels can also be caused by other conditions, such as an enlarged prostate or inflammation of the prostate. The DRE involves a healthcare provider inserting a gloved, lubricated finger into the rectum to feel the size, shape, and texture of the prostate. If either of these tests suggests the possibility of prostate cancer, further tests, such as a prostate biopsy, may be needed to confirm the diagnosis. Treatment options for prostate cancer depend on the stage of the disease, the patient's age and overall health, and other factors. Options can include active surveillance, surgery, radiation therapy, hormone therapy, chemotherapy, and targeted therapy. Active surveillance, also known as watchful waiting, involves closely monitoring the cancer without active treatment. This approach may be suitable for men with low-risk, slow-growing prostate cancer. Surgery to remove the prostate, known as a prostatectomy, is a common treatment for localized prostate cancer. Radiation therapy uses high-energy rays to kill cancer cells and is another option for localized prostate cancer. Hormone therapy, also known as androgen deprivation therapy, reduces the levels of male hormones that can promote the growth of prostate cancer cells. Chemotherapy uses drugs to kill cancer cells and is typically used for advanced prostate cancer. Targeted therapy involves drugs that specifically target cancer cells while sparing normal cells. Living with prostate cancer can be challenging, but there are many resources and support systems available. It's important to have open and honest communication with your healthcare provider about your treatment options and any side effects you may experience. Support groups, counseling, and educational resources can also be helpful. Now let's talk about testosterone. Testosterone is the primary male sex hormone and plays a key role in the development of male reproductive tissues, such as the testes and prostate, as well as promoting secondary sexual characteristics, such as increased muscle and bone mass and the growth of body hair. It also plays a role in health and well-being and can influence mood, energy levels, and overall health. Low testosterone, also known as hypogonadism, can occur when the body doesn't produce enough testosterone. This can be caused by a variety of factors, including aging, injury to the testes, chronic illnesses, and certain medications. Symptoms of low testosterone can include fatigue, decreased libido, erectile dysfunction, mood changes, decreased muscle mass, increased body fat, and decreased bone density. If you experience these symptoms, it's important to see a healthcare provider who can perform a blood test to measure your testosterone levels. Treatment for low testosterone can include testosterone replacement therapy, TRT, which can be administered through injections, patches, gels, or pellets. TRT can help improve symptoms, but it also has potential risks and side effects, including an increased risk of heart disease, sleep apnea, and prostate problems. It's important to discuss the benefits and risks of TRT with a healthcare provider. Maintaining healthy testosterone levels can also involve lifestyle changes. Regular exercise, especially resistance training, can help boost testosterone levels. A balanced diet rich in vitamins and minerals, particularly zinc and vitamin D, can also support healthy testosterone levels. Getting enough sleep, managing stress, and avoiding excessive alcohol consumption can also be beneficial. In addition to prostate cancer and testosterone, there are other important men's health concerns to be aware of. Heart disease is the leading cause of death for men, and risk factors include high blood pressure, high cholesterol, smoking, diabetes, and a family history of heart disease. Maintaining a healthy lifestyle, including a balanced diet, regular exercise, and managing stress, can help reduce the risk of heart disease. Regular checkups with a healthcare provider can also help monitor heart health. Mental health is another important aspect of men's health. Men are often less likely to seek help for mental health issues, but it's important to recognize that mental health is just as important as physical health. Depression, anxiety, and other mental health issues can affect men of all ages. Seeking support from a mental health professional, practicing self-care, and building a strong support network can help manage mental health concerns. Diabetes is another common health issue in men. Type 2 diabetes, which is often related to lifestyle factors such as diet and physical activity, is the most common form. Managing diabetes involves monitoring blood sugar levels, eating a healthy diet, getting regular exercise, and taking medications as prescribed by a healthcare provider. Regular checkups with a healthcare provider can help manage diabetes and prevent complications. Sexual health is also an important aspect of men's health. Erectile dysfunction, ED, which is the inability to achieve or maintain an erection sufficient for sexual intercourse, is a common issue in men, especially as they age. ED can be caused by a variety of factors, including cardiovascular disease, diabetes, high blood pressure, smoking, obesity, and psychological factors. Treatment options for ED include medications, such as phosphodiesterase inhibitors, for example Viagra, Cialis, lifestyle changes, counseling, and other medical treatments. It's important to talk to a healthcare provider about ED, as it can sometimes be a sign of underlying health issues. Testicular health is another important consideration for men. Testicular cancer, while less common than other types of cancer, is the most common cancer in men aged 15 to 35. Regular self-examinations can help detect any changes or lumps in the testicles, which should be reported to a healthcare provider. Early detection and treatment are crucial for testicular cancer. Benign prostatic hyperplasia, BPH, or an enlarged prostate, is another common issue in men as they age. BPH is not cancerous, but it can cause symptoms such as difficulty urinating, a weak urine stream, frequent urination, and the feeling of incomplete bladder emptying. Treatment options for BPH include medications, minimally invasive procedures, and surgery. It's important to talk to a healthcare provider about any urinary symptoms, as they can also be caused by other conditions. Obesity is another significant health issue for men. Being overweight or obese increases the risk of many health problems, including heart disease, diabetes, high blood pressure, and certain cancers. Maintaining a healthy weight through a balanced diet and regular physical activity is crucial for overall health. It's also important to seek support for weight loss if needed, as losing even a small amount of weight can have significant health benefits. Sleep is another important aspect of men's health. Poor sleep quality or insufficient sleep can affect overall health and well-being. Conditions like sleep apnea, which is characterized by repeated interruptions in breathing during sleep, are common in men and can have serious health consequences if left untreated. Maintaining good sleep hygiene, such as keeping a regular sleep schedule, creating a relaxing bedtime routine, and avoiding screens before bed, can help improve sleep quality. If sleep problems persist, it's important to talk to a healthcare provider. In addition to these health concerns, maintaining overall wellness involves regular checkups and screenings. Regular physical exams, blood pressure checks, cholesterol tests, and cancer screenings can help detect health issues early and prevent complications. It's also important to have open and honest communication with healthcare providers about any health concerns or symptoms. In conclusion, men's health is a complex and multifaceted issue that requires attention and care. By staying informed, maintaining a healthy lifestyle, and seeking support when needed, men can take control of their health and well-being. Thank you for joining me on Banana Life. I hope you found this information helpful and empowering. Men's health is a crucial topic that deserves more attention and understanding. By taking care of your health and advocating for yourself, you can lead a fulfilling and healthy life. Remember, you are not alone, and there are resources and communities available to support you on your journey. Stay positive, take care of yourself, and I'll see you next time.